In medieval times, medical practices were often rudimentary, filled with superstition, and lacking the scientific understanding we have today. One of the most widely practiced, yet deeply flawed procedures was bloodletting. Bloodletting was believed to balance the humors in the body: blood, phlegm, black bile, and yellow bile, according to the popular medical theories of the time. This practice, widely endorsed by physicians, was supposed to cure a range of ailments, from fevers to headaches and even mental health disorders. However, in reality, bloodletting more often harmed patients than helped them, weakening their bodies and leaving them vulnerable to infection. Medieval surgeons, who were often barber-surgeons, used a range of tools that were both rudimentary and unhygienic. The most common instrument was the lancet, a sharp, pointed blade that could pierce the skin to allow blood to flow out. The lancet was used without any form of sterilization, as the concepts of germs and bacteria were not yet understood. As a result, many patients who underwent bloodletting were at significant risk of infections, which could prove fatal. The use of these unclean tools, combined with the absence of antiseptics, turned what was supposed to be a healing process into a dangerous and potentially life-threatening procedure. The practice of bloodletting was often conducted by barber-surgeons, who combined haircutting with basic medical procedures. These surgeons were not trained doctors, but rather individuals who learned their craft through apprenticeships. While they could perform surgeries, including amputations, they lacked the formal medical education to understand the risks associated with their actions. Most often, barber surgeons would use their lancets to drain blood from a patient's veins, typically in the arm or neck, based on where the illness was believed to reside. However, these practices were done without any knowledge of blood circulation or the importance of preserving bodily fluids. In addition to bloodletting, other barbaric surgeries were common in the medieval period. Without the ability to sterilize equipment or even clean wounds properly, surgeries were often painful, traumatic, and filled with risks of infections. Amputations, trepanations, drilling holes into the skull to relieve pressure, and even the removal of tumors were performed with the most basic of tools, including knives, saws, and crude metal instruments. Surgeons had no understanding of the need for sterilization or the connection between bacteria and disease, which resulted in many patients suffering from infections and dying shortly after surgery. Another disturbing aspect of medieval surgeries was the complete lack of anesthesia. Surgeons would often use alcohol, opium, or even hypnosis to dull the pain, but for the most part, patients were forced to endure excruciating procedures while fully conscious. In the case of bloodletting, the procedure was often repeated several times over a period of days, causing the patient to weaken significantly. The physical trauma, combined with the infections introduced by unsanitary practices, made medieval surgeries incredibly dangerous. Infections were a significant cause of death during this period, as medical knowledge regarding bacteria and germs was non-existent. Wounds from surgery were often left uncovered, and many surgeons believed that exposure to air was beneficial for healing. This misunderstanding only allowed for more bacteria to enter the body, often leading to sepsis or gangrene, which were fatal conditions. Patients who survived the initial surgery often succumbed to these infections shortly afterward, highlighting the dangerous nature of medieval surgery. Despite the overwhelming evidence that these practices were ineffective and harmful, bloodletting and barbaric surgeries persisted for centuries. They were deeply ingrained in the medical community and widely believed to be effective. The practice of bloodletting, for example, wasn't officially abandoned until the 19th century, despite its obvious lack of success. Even after the development of germ theory and the understanding of proper sterilization techniques, many physicians clung to old practices out of tradition and a reluctance to accept new ideas. The advancement of surgery and medicine in the medieval period was hampered by the lack of scientific knowledge. Surgeons operated without understanding basic anatomy, and their knowledge of human biology was limited at best. With no microscopes or advanced diagnostic tools, physicians were left to rely on outdated medical theories. The result was a profession that, while trying to heal, often caused more harm than good. The absence of hygiene, proper tools, and training in sanitation left countless patients vulnerable to infections, complications, and death. Today, we look back on the medieval surgeon's toolkit with horror and disbelief, but we must also recognize how far medicine has come. The practice of bloodletting, once seen as a panacea for many illnesses, is now understood to have been not only ineffective, but also harmful. Modern medicine, with its advanced surgical techniques, sterilization methods, and understanding of human biology, has allowed us to make incredible progress in treating and preventing disease. The barbaric surgeries of the medieval era are a grim reminder of the importance of scientific progress and the need to constantly challenge outdated beliefs in the pursuit of better health. While medieval medicine may seem primitive and inhumane by today's standards, it laid the foundation for the medical advances we now take for granted. The history of bloodletting and barbaric surgeries serves as a stark reminder of how far we've come in understanding the human body and the importance of hygiene, proper tools, and scientific research. In the centuries since these dark times, medical professionals have honed their skills and knowledge, ensuring that such practices never again have a place in modern healthcare. Medieval surgery was a field defined by rudimentary techniques, primitive tools, and an almost complete lack of understanding regarding hygiene and sterilization. The role of the surgeon during the medieval period was often filled by individuals known as barber-surgeons. These barber-surgeons were a unique group of practitioners who combined the tasks of cutting hair, performing tooth extractions, and performing surgical procedures such as bloodletting and amputations. Although the barbers were known for their ability to perform a variety of tasks, they lacked formal medical education. As a result, they relied heavily on ancient medical practices that were both ineffective and dangerous, often using tools and techniques that by modern standards were unhygienic and outdated. One of the most common and significant tools used by medieval surgeons was the lancet, a small, sharp, pointed blade designed to pierce the skin. The lancet was used for a variety of medical procedures, but it was most commonly associated with bloodletting. Bloodletting was believed to balance the body's humors, a concept rooted in ancient Greek medicine, which held that a person's health was governed by four essential fluids: blood, phlegm, black bile, and yellow bile. If these humors became unbalanced, it was thought to cause illness. The lancet was used to draw blood from a patient in an attempt to correct this imbalance. The practice was widely endorsed by physicians and was performed for a broad range of ailments, from fevers to headaches and even mental health disorders. However, the lancet, along with other tools of medieval surgery, posed significant risks to patients, both during and after the procedure. Perhaps the most glaring issue was the lack of sterilization. In an era before the discovery of germs, bacteria, or viruses, the concept of sterilizing medical instruments was entirely unknown. Surgeons would use the same lancet repeatedly without cleaning or disinfecting it, which meant that bacteria from one patient could easily be transferred to the next. In an age when diseases like sepsis and gangrene were not understood, the risk of infection was extremely high. The lack of understanding regarding infection control meant that the lancet, which was intended to help cure patients, was often the cause of further harm. Many patients who underwent bloodletting experienced severe infections at the site of the incision. Without any form of antiseptic or antiseptic knowledge, surgeons did not have the means to prevent these infections. Infections, which were often caused by bacteria entering the wound during the procedure, could lead to serious complications. In some cases, these infections would spread to the bloodstream, leading to sepsis, a potentially fatal condition that would overwhelm the body's immune system. Other times, the infections would lead to the development of gangrene, a condition where tissue in the body dies due to lack of blood flow, often resulting in the need for amputation. Additionally, the lancet was used in environments that lacked even the most basic hygiene standards. Medieval operating rooms were not equipped with the sterile tools, clean linens, or antiseptic solutions that we associate with modern surgery. The operating area was often unsanitary, with the floor of the room, the surgeon's hands, and the tools used all exposed to dirt and contaminants. The lack of proper sanitation contributed to the high rate of infection following surgery. In many cases, the patient's wounds were left exposed to the air, which, based on the medical theories of the time, was thought to be beneficial. However, this only increased the risk of infection, as harmful bacteria in the environment had easy access to the wound. Furthermore, the lancet was not the only tool used by medieval surgeons. The surgeon's toolkit included other rudimentary and unsanitary instruments, such as knives, scalpels, saws, and trepanation tools. These instruments were used to perform a wide variety of procedures, including amputations, the removal of tumors, and even trepanation, a procedure in which a hole was drilled into the skull. Each of these instruments posed similar risks, as they were often used without sterilization and could cause infections. In the case of amputations, for example, surgeons used large saws to remove limbs. While the saw itself was effective at cutting through bone, it was also a prime breeding ground for bacteria, as the blades were not cleaned between uses. The complete absence of sterilization techniques meant that medieval surgeons were unaware of how bacteria could enter the body through broken skin or open wounds. In fact, many surgeons operated under the belief that wounds healed best when exposed to the air, a theory that we now know to be incorrect. The exposure of open wounds to the air often allowed bacteria to infect the body, leading to deadly complications. Even if a patient survived the immediate procedure, the risk of infection remained high, and the chances of recovery were slim. Many medieval surgeries resulted in complications such as sepsis, gangrene, or other fatal infections. To make matters worse, the lack of anesthesia and pain management in medieval surgery meant that patients were forced to endure extremely painful procedures while fully conscious. Without access to modern anesthesia, the surgeon would often attempt to dull the pain with alcohol or opium. However, these substances were far from effective in blocking the intense pain associated with surgery. As a result, Patients often experienced excruciating pain while undergoing procedures such as bloodletting or amputations. Some patients would even be physically restrained during surgery to prevent them from moving or reacting to the pain. This lack of pain management, combined with the risk of infection and the use of unsanitary tools, made medieval surgery a terrifying and often deadly experience. The inability to control infection and manage pain during surgery was a significant factor in the high mortality rate associated with medieval surgery. Even if the procedure itself was performed correctly, the patient's chances of survival were slim due to the lack of hygiene and medical knowledge. In some cases, the patient would succumb to infection shortly after the surgery, even if the procedure itself was successful. This high rate of death and complications made many people reluctant to seek surgical intervention, and surgery was often seen as a last resort. Despite the obvious dangers of medieval surgery, the practice of bloodletting and the use of unsanitary tools persisted for centuries. One of the main reasons for this persistence was the lack of alternatives. In an age before antibiotics, vaccines, and advanced medical treatments, bloodletting and other rudimentary surgical procedures were the best available options. The belief in humoral medicine and the idea that the balance of the four humors affected a person's health remained deeply entrenched in medical thought. As a result, many people were willing to undergo dangerous procedures, even when the risks were well known. In some cases, bloodletting and other surgeries became so deeply ingrained in medical practice that they were performed as routine treatments for a wide range of conditions. It was not unusual for individuals to undergo bloodletting on a regular basis in an attempt to prevent illness, even if they were not suffering from any apparent symptoms. The persistence of these practices, despite their dangers, was a result of the deep seated belief in their effectiveness and the lack of better treatment options. Over time, as medical knowledge advanced and new technologies emerged, the use of bloodletting and unsanitary surgical practices began to decline. The development of germ theory and the discovery of bacteria helped to explain the connection between infection and surgery. As sterilization techniques were introduced, surgical practices improved, and the use of unhygienic tools began to diminish. However, the legacy of medieval surgery serves as a stark reminder of the importance of hygiene, sterilization, and scientific understanding in the practice of medicine. In conclusion, the tools used by medieval surgeons, particularly the lancet, played a significant role in the harmful and dangerous practices of bloodletting and surgery during the medieval period. The lack of sterilization and the absence of anesthesia contributed to high rates of infection and death among patients who underwent surgery. The legacy of these practices highlights the importance of hygiene, scientific progress, and a better understanding of the human body in modern medical care. The barbaric surgeries of the medieval era may seem distant and primitive, but they laid the groundwork for the advances in medicine that would come in later centuries. The practice of bloodletting in medieval times was deeply intertwined with the work of barber-surgeons, a unique class of medical practitioners who performed both everyday grooming tasks and a variety of medical procedures. These barber surgeons, while often capable of performing surgeries such as amputations, wound treatment, and tooth extractions, were not formally trained doctors. Instead, their knowledge came from apprenticeships and hands on experience, learning from their mentors or other practitioners in the field. Though they were highly skilled in their trade, The lack of formal medical education meant they were often unaware of the fundamental principles that we now understand as essential to good medical practice, especially concepts such as blood circulation, infection control, and the preservation of bodily fluids. The barber surgeon's dual role as both medical professionals and barbers placed them in a position of significant influence during the medieval period. They were typically the ones who performed bloodletting, an accepted medical practice used to treat a wide range of conditions, from fevers and headaches to more complex illnesses such as digestive disorders and mental health conditions. In an era where the science of medicine was rudimentary and based largely on ancient and often inaccurate beliefs, the knowledge of these barber surgeons was limited. Yet, they were at the forefront of medical procedures, having learned how to treat ailments through observation and apprenticeships rather than academic study. Bloodletting itself was rooted in the ancient Greek concept of humoral medicine, which postulated that health was governed by a balance of four bodily fluids or humors: blood, phlegm, black bile, and yellow bile. According to the humoral theory, if these humors became unbalanced, it could lead to illness or disease. Bloodletting was thought to restore harmony by reducing the excess of blood, which was believed to be the cause of many diseases. The procedure was carried out using various tools, but the lancet, a small, sharp instrument with a pointed tip, was the most commonly employed. The lancet was typically used to puncture the skin and allow blood to flow out of a patient's veins, most often in the arm or neck. This process was believed to purge the body of excess blood and thereby cure the illness. However, the practice of bloodletting, as performed by barber surgeons, was based on flawed and outdated medical theories. Most barber surgeons performed the procedure without any understanding of the circulation of blood or the complexities of the human body. The ancient Greek physician Galen, whose theories dominated medieval medical thought, believed that blood flowed through the body in a continuous cycle, though he misunderstood its movement. As a result, bloodletting was often performed indiscriminately, even when it was not appropriate for the patient's condition. The lancet was used to drain blood from various parts of the body, particularly the arm or neck, depending on where the illness was believed to reside. If a patient suffered from a fever, for example, the lancet might be used to release blood from their arm, as it was thought that this would help cool the body and restore balance. The lack of formal medical education among barber surgeons meant that they often had no understanding of blood circulation or the importance of preserving bodily fluids. While the concept of blood circulation was not understood at the time, modern knowledge tells us that blood is essential for the transport of oxygen and nutrients to the body's tissues. Without an adequate amount of blood, the body would be unable to function properly, and draining too much blood could lead to dangerous consequences, such as hypovolemic shock, a life-threatening condition caused by a significant loss of blood volume. However, barber surgeons were unaware of these risks, and bloodletting was often performed repeatedly, sometimes over several days, in the belief that it would continue to purge the body. The belief in humoral imbalance and the overuse of bloodletting often led to weakened patients who were left more vulnerable to further illness. In some cases, excessive blood loss during a single session was enough to cause harm. For individuals suffering from diseases such as anemia or those already weakened by chronic illness, bloodletting was a dangerous practice that could exacerbate their condition. For these patients, the draining of blood could be fatal. Yet despite these risks, Bloodletting was widely practiced for centuries, not only by barber surgeons, but also by trained physicians who shared the same belief in the humoral theory of disease. While the lancet was the primary tool used for bloodletting, barber surgeons often employed a variety of other instruments during their medical procedures. For example, they would use cupping glasses to create a vacuum on the skin in an attempt to draw out blood or fluid. Leeching, which involved the use of leeches to suck blood from a patient's body, was another common practice performed by barber surgeons. Both methods, like bloodletting with the lancet, were based on the belief that removing blood from the body would restore balance and health. In addition to these instruments, the barber surgeons also used crude surgical tools, such as knives, saws, and scalpels, to perform more invasive procedures, including amputations and trepanations. These tools, however, were often far from sterile and were reused between patients without any form of sanitation, leading to an increased risk of infection. The use of these unsanitary tools was especially problematic in an era where there was no understanding of germs, bacteria, or the importance of sterilization. The risk of infection following a bloodletting procedure was high, as the lancet and other instruments were often contaminated with bacteria from previous patients. Medieval surgeons did not possess the knowledge of hygiene and infection control that we take for granted today. The concept of sterilizing surgical tools, washing hands before procedures, or even preventing the spread of infection was not known. As a result, many patients who underwent bloodletting or other surgeries performed by barber surgeons contracted serious infections, some of which led to death. Barber surgeons, despite their lack of formal medical training, played an essential role in medieval society. They were responsible for performing basic medical procedures, and their work often extended beyond simple bloodletting. In addition to bloodletting, they were called upon to treat wounds, set broken bones, and perform minor surgeries. In many ways, they were the equivalent of general practitioners in a time when formal medical schools and the education of doctors were still in their infancy. However, their education was based on apprenticeship, which meant that the knowledge they acquired was not based on scientific principles, but on a system of trial and error, as well as the teachings of older, often outdated, medical authorities like Galen. Although barber surgeons were skilled in many areas, their limited education meant that they lacked a clear understanding of anatomy and physiology. The body's complex systems were not yet understood, and so their surgical procedures often involved guesswork. When performing surgeries like bloodletting, there was little to guide them in terms of knowing how much blood to remove or which parts of the body were most affected by the illness. As a result, the procedures were often performed recklessly, with little regard for the patient's overall health or condition. In addition to bloodletting, barber surgeons were responsible for some of the most basic forms of surgery, such as amputations. Amputations, which were performed to remove limbs that were severely injured or infected, were often carried out using rudimentary instruments like saws and knives. These surgeries were incredibly painful, and with no form of anesthesia, patients had to endure the excruciating procedure fully conscious. The lack of sterilization during these surgeries meant that infections were common and often deadly. It was not unusual for patients to succumb to post-surgical infections like gangrene, which could develop quickly in unsanitary conditions. Despite the risks and lack of formal training, bloodletting and other procedures performed by barber surgeons were deeply embedded in medieval medical practice. Their widespread use persisted well into the Renaissance, even as new ideas about health and the human body began to emerge. The persistence of these outdated practices can be attributed, in part, to the deep cultural and medical beliefs that underpinned medieval healthcare. Bloodletting was not merely a physical procedure, but also a symbolic act, rooted in the understanding that health was a balance of humors, a balance that could be restored through the removal of blood. As time went on, however, the practice of bloodletting began to decline with the development of more accurate anatomical knowledge, the rise of scientific medicine, and a better understanding of human physiology. The belief in humoralism and the need for bloodletting started to fade. It was not until the 19th century that bloodletting was officially abandoned in favor of more effective medical treatments. The legacy of the Barber-surgeons, though, remains an important part of medical history, providing insight into the primitive yet evolving nature of medicine during the medieval period. In conclusion, the practice of bloodletting, performed by barber surgeons using lancets and other rudimentary tools, was a significant part of medieval medical practice. However, the lack of formal training, understanding of anatomy, and knowledge of infection control meant that these procedures were often ineffective, dangerous, and life threatening. While bloodletting persisted for centuries, its decline marked a turning point in the history of medicine as more scientifically grounded approaches to healthcare began to emerge. In addition to bloodletting, the medieval period saw the widespread use of other invasive and often barbaric surgical procedures. These surgeries, despite being essential for treating severe injuries and medical conditions, were conducted with rudimentary tools, a lack of scientific knowledge, and little regard for hygiene or infection control. Surgeons of the time, who were often barber surgeons with little to no formal medical education, were tasked with performing some of the most painful, traumatic, and life-threatening procedures known to humans. The absence of basic surgical techniques, modern anesthesia, and sterilization meant that patients undergoing these procedures faced enormous risks, including prolonged pain, excessive blood loss, and the possibility of fatal infections. Amputations were among the most common and necessary surgeries performed in the medieval period, often due to trauma, infection, or disease. A limb might be amputated if it was severely damaged, infected, or if gangrene set in. The process of amputation was a brutal and incredibly painful procedure. Surgeons used rudimentary tools like knives, saws, and cleavers to remove the affected part of the body. The tools themselves were far from sterile, having been used repeatedly on different patients without any form of cleaning. As a result, the risk of infection was astronomically high, and it was not uncommon for patients to succumb to sepsis or gangrene shortly after the procedure. Without anesthesia or effective pain relief, amputations were performed while the patient was fully conscious, often under the influence of alcohol or opium to dull the pain, but it was far from sufficient. In fact, many patients would die from shock or excessive blood loss during the procedure, making it a last resort for those who had no other option. The surgical environment itself was equally as dangerous as the procedures. Surgeons lacked any knowledge of proper sanitation practices, and the operating room would often be filthy, with no effort made to sterilize instruments, dressings, or even the surgeon's hands. The medieval concept of infection was based on the idea of bad air, or miasma, and there was no understanding of the germ theory of disease, which would not be discovered until centuries later. As a result, surgical procedures like amputations often led to infections that would prove fatal. Even if the patient survived the initial procedure, complications like sepsis would often arise from the unclean instruments and unsanitary conditions. Another gruesome and barbaric procedure, common in medieval surgery, was trepanation, which involved drilling or scraping a hole in the skull. This was done for various reasons, such as relieving pressure on the brain following a head injury, treating certain mental health disorders, or even as a cure for headaches or epilepsy. The belief that trepanation could release evil spirits or humors from the brain was rooted in ancient medical theories, and despite the lack of understanding of brain function, this practice persisted for centuries. Trepanation was performed with crude metal instruments such as scalpels, drills, or saws. In some cases, a surgeon would use a hand cranked instrument to drill into the skull, while in others, the surgeon would use a manual saw to cut through the bone. The idea behind trepanation was that by creating an opening in the skull, pressure would be relieved or harmful substances would be released, supposedly curing the patient's illness. However, the risks involved in this procedure were enormous. The skull was often not anesthetized, meaning the patient would experience excruciating pain during the procedure. Additionally, the risk of infection was high, as the surgical instruments were rarely sterilized and the wound was left open to the environment. Even a minor infection could lead to severe complications, including brain abscesses, meningitis, or death. It is believed that many people who underwent trepanation survived the procedure, but most did so with severe neurological impairments or even permanent brain damage. Trepanation, along with amputations, was typically carried out by barber-surgeons, individuals who were not formally trained in medicine, but who had learned their craft through apprenticeships and hands-on experience. While barber-surgeons were skilled in performing these kinds of procedures, their lack of formal education meant that they were unaware of the underlying biological mechanisms at play, and they had little understanding of anatomy, physiology, or the importance of sterilization. Surgeons did not know how to clean or sterilize their instruments, and as a result, the risk of infection was immense. The failure to understand the role of bacteria in causing infections led to many patients suffering from post surgical complications that could have been avoided with proper hygiene. Another common surgery in medieval times involved the removal of tumors, a procedure that could be just as brutal and dangerous as amputations or trepanations. Tumors, both benign and malignant, were often removed by the medieval surgeon, but the tools available to perform the surgery were inadequate at best. Surgeons would use knives, scissors, and crude instruments to remove growths, but the lack of effective anesthesia meant that the patient would endure significant pain during the operation. The surgeon had no way of knowing whether the tumor was malignant, and the lack of antiseptics or sterilization meant that infections were a common outcome. Even if the tumor was successfully removed, many patients would suffer from complications, including wound infections, septicemia, and gangrene. As with other surgical procedures of the time, the mortality rate for tumor removal was high, and many people died either during the operation or from complications shortly after. In addition to the lack of anesthesia, surgeons also had no knowledge of blood clotting or the need to control bleeding during surgery. Without modern sutures, cauterization, or hemostatic agents, controlling bleeding during surgery was a major challenge. After amputations or trepanations, bleeding was often difficult to control, and excessive blood loss was common. In some cases, the surgeon would attempt to control bleeding by applying pressure, but this was often ineffective. The patient could easily bleed to death, either from the surgical site or from internal hemorrhaging. The lack of blood transfusions or modern surgical techniques meant that even minor surgeries could be life-threatening. The absence of sterilization and antiseptic techniques contributed to the high rates of infection following medieval surgeries. Surgeons use the same tools on multiple patients without cleaning or sterilizing them, allowing bacteria to spread from one patient to the next. This lack of hygiene meant that even the simplest procedures, such as bloodletting or dressing a wound, carried a high risk of infection. The open nature of many surgical wounds, such as amputations or trepanation, provided an entry point for bacteria, which could cause severe, sometimes fatal, infections. Post-surgical infections were often treated with crude remedies, such as poultices, herbs, or alcohol, but these were ineffective in preventing or treating infections. Surgeons of the time also had a limited understanding of anatomy and physiology. The dissection of human cadavers was not widely practiced in medieval Europe, and therefore surgeons often worked with incomplete or inaccurate knowledge of the body. They relied on ancient texts and theories from Greek and Roman physicians like Galen, whose work was widely respected but also based on incorrect ideas. The lack of knowledge of human anatomy meant that medieval surgeons often performed surgeries without a clear understanding of the body's internal structures, increasing the risk of injury or complications. For example, during amputations, surgeons could easily sever important nerves, blood vessels, or muscles, leading to further injury and even death. Despite the significant risks and limitations of medieval surgery, the lack of better options meant that many people sought out these procedures as a last resort. In a time when diseases like plague, infection, and injury were common, medieval surgery was often seen as the only available option for those suffering from serious health conditions. However, the high rates of infection, blood loss, and complications meant that surgery was often a grim and terrifying experience, with no guarantee of success. As medical knowledge advanced, many of the barbaric practices of medieval surgery were gradually abandoned. The development of modern anesthetics, antiseptics, and surgical techniques in the 19th century revolutionized the field of surgery and made these painful and dangerous procedures obsolete. Today, surgeons have access to advanced tools, sterilization methods, and a deep understanding of human anatomy and physiology, allowing for safer and more effective surgeries. The legacy of medieval surgery, however, serves as a reminder of the importance of hygiene, scientific knowledge, and medical progress in the advancement of healthcare. In conclusion, the barbaric surgeries of the medieval period, including amputations, trepanations, and tumor removals, were often performed with crude tools and without an understanding of the risks of infection or the need for sterilization. Surgeons of the time lacked formal education and were unaware of the importance of hygiene, anatomy, and blood circulation. As a result, many patients suffered from infections, excessive blood loss, and other complications that could often be fatal. While these surgeries were necessary at times, they were fraught with risks and were often performed under the most unsanitary and painful conditions. The evolution of modern surgery has greatly reduced the risks associated with these procedures, but the grim history of medieval surgery highlights the importance of scientific progress in the field of medicine. Another deeply disturbing aspect of medieval surgeries was the complete lack of effective anesthesia. In a time when medical knowledge was rudimentary and the understanding of pain and its management was almost non existent, surgery was an incredibly traumatic experience. The lack of anesthetics meant that patients undergoing surgery or any invasive procedure were often forced to endure excruciating pain while fully conscious. This was especially problematic given that many of the surgeries performed during this time were complex, invasive, and performed without any consideration for hygiene or infection control. The absence of anesthesia, combined with the brutality of medieval surgical techniques, created a horrifying situation where patients were left to suffer through procedures that were not only physically painful, but also incredibly dangerous. In modern medicine, anesthesia is a fundamental part of most surgical procedures. It ensures that patients remain unconscious and pain free, allowing surgeons to perform complex operations without causing undue trauma to the patient. However, in the medieval period, the concept of anesthesia was not yet understood, and surgical procedures were carried out with little to no regard for pain relief. The surgical environment itself was extremely basic, often lacking sterile instruments, clean conditions, and effective methods for controlling bleeding or managing pain. As a result, medieval surgery was synonymous with agony, fear, and sometimes death. This lack of anesthesia made the already difficult and often unsuccessful procedures even more excruciating for the patients who had no other choice but to undergo them. To manage pain, medieval surgeons resorted to a few crude methods, but these were far from effective and did little to dull the excruciating agony that patients endured during surgery. One of the most commonly used substances was alcohol, typically wine or strong spirits, which was given to patients before and during surgery in the hope that it would numb their senses. However, alcohol was a poor analgesic and was insufficient for the kind of pain experienced during surgery. While it might have had a slight sedative effect, alcohol could not fully anesthetize a person, and the pain of even minor procedures could still be unbearable. In addition, alcohol did little to reduce anxiety or fear, which were also significant sources of distress for the patient. Opium was another substance that medieval surgeons sometimes used to dull the pain of surgery. Opium, derived from the poppy plant, was known for its pain relieving properties, and it had been used for thousands of years in various cultures as a form of pain management. However, the use of opium was rudimentary and inconsistent in the medieval period. It was typically given in the form of a crude tincture or simply chewed, and while it may have provided some temporary relief, it was nowhere near as effective as modern anesthetics. Additionally, the dosage of opium could not be carefully controlled, which meant that patients could either be given too little, resulting in ineffective pain relief, or too much, which could lead to respiratory depression, overdose, or death. Hypnosis, or what was known as mesmerism during the medieval period, was another method sometimes used to help patients cope with the pain of surgery. Mesmerism, named after the German physician Franz Anton Mesmer, involved inducing a trance-like state in the patient to dull their awareness of pain. However, the practice of hypnosis was not well understood at the time, and its effectiveness varied greatly from person to person. While some patients may have experienced a degree of relief from their pain through hypnosis, it was not a reliable or consistent method for managing the intense physical trauma of medieval surgery. In most cases, patients were simply left to endure the pain of the procedure with little to no help. For many patients, the experience of medieval surgery was not only physically painful, but also psychologically traumatic. The fear of undergoing surgery, combined with the pain and helplessness associated with it, could lead to significant mental distress. In many cases, patients were restrained during the procedure to prevent them from moving or reacting to the pain. These restraints were often crude, using ropes or leather straps to tie the patient down. The sheer terror of the situation, combined with the inability to escape the agony of the surgery, created an atmosphere of immense suffering. In some cases, patients would faint from the pain or shock, but for the most part, they remained fully conscious, enduring the procedure in a state of intense pain and fear. The physical trauma of medieval surgery was made even worse by the lack of sanitation and proper infection control. Surgeons of the time had no understanding of germs or bacteria, and as a result, the tools they used were rarely sterilized. Instruments such as knives, lancets, and saws would often be used on multiple patients without any form of cleaning, increasing the risk of infection. Wounds were often left uncovered, and patients were not given any antibiotics or antiseptics to prevent infection. The absence of antiseptic techniques meant that many patients who survived the initial surgery later succumbed to infections such as sepsis or gangrene, which were common and often fatal in the medieval period. Even the process of bloodletting, a common medical treatment of the time, involved repeated trauma to the body. Bloodletting was believed to restore balance to the body's humors, but the procedure was often performed without any understanding of the circulatory system or the risks associated with excessive blood loss. Patients undergoing bloodletting were often subjected to the procedure multiple times over several days, which weakened them significantly. The repeated loss of blood could lead to anemia, shock, and even death, especially for those who were already ill or weak. Moreover, the instruments used for bloodletting, such as lancets or leeches, were not sterilized, increasing the risk of infection. The lack of effective anesthesia during bloodletting made the experience even more traumatic for patients. Not only were they subjected to the pain of the procedure, but they also had to endure the physical weakness caused by the blood loss. The trauma of having blood drawn repeatedly, often from sensitive areas such as the veins in the arm or neck, combined with the excruciating pain, left many patients in a state of physical and emotional distress. For many, the experience of bloodletting was not only physically debilitating, but also psychologically scarring, as they were unable to escape the pain or the sense of helplessness that came with the procedure. The barbarity of medieval surgery, with its reliance on crude tools, lack of anesthesia, and unsanitary conditions, meant that many patients died shortly after their procedures, often from infections or complications related to blood loss. Even if the patient survived the immediate surgery, they faced a high risk of post-operative infections, as the wounds were typically left untreated and exposed to the elements. The development of antiseptics and the understanding of the role of bacteria in causing infection would not occur until centuries later, and until that time, patients undergoing surgery in the medieval period had little hope of surviving the risks associated with the procedures. The lack of anesthesia in medieval surgery was part of a broader issue. the overall lack of medical knowledge and understanding of the human body. Surgeons of the time relied heavily on ancient medical theories and practices, many of which were based on superstition and outdated beliefs. The humoral theory, which suggested that disease was caused by an imbalance of the body's four humors, was the dominant medical paradigm, and treatments such as bloodletting, trepanation, and amputations were common. However, these treatments were often ineffective and caused more harm than good, as they failed to address the true causes of disease or injury. The absence of anesthesia in medieval surgery was a reflection of the broader limitations of medical knowledge at the time. Surgeons did not understand the need for sterilization, the importance of preserving bodily fluids, or the mechanisms of pain and trauma. They were working in a medical environment that was more reliant on tradition, superstition, and trial and error than on scientific principles. As a result, the patient's experience of medieval surgery was one of intense suffering, physical trauma, and often death. The history of medieval surgery highlights the tremendous progress that has been made in modern medicine. Today, patients undergoing surgery are typically given anesthesia to ensure that they remain pain free throughout the procedure, and advances in sterilization techniques and antibiotics have drastically reduced the risk of infection. The use of modern surgical tools and techniques, along with a much deeper understanding of human anatomy and physiology, has made surgery far safer and more effective. However, the legacy of medieval surgery serves as a reminder of how far we have come in the pursuit of better healthcare and the importance of continuing to advance our understanding of the human body and how it works. In conclusion, the complete lack of anesthesia during medieval surgeries made the experience not only physically excruciating, but also incredibly dangerous. Patients were subjected to extreme pain during a variety of invasive procedures, including bloodletting, amputations, and trepanations, often while fully conscious. The trauma caused by these procedures, combined with the lack of sanitation and proper infection control, led to a high mortality rate for patients undergoing surgery. The development of modern anesthesia, antiseptics, and surgical techniques has since transformed the field of surgery, but the barbaric nature of medieval surgery serves as a grim reminder of the limitations of medical knowledge and the suffering endured by patients in an era without effective pain, relief, or infection control. Infections were a significant cause of death during the medieval period, and the lack of understanding about bacteria, germs, and the mechanisms behind infections contributed heavily to the high mortality rates among patients who underwent surgery or other medical procedures. The absence of modern medical knowledge about microorganisms meant that surgeons and medical practitioners of the time had little to no awareness of the role that bacteria played in causing illness. The idea that diseases could be transmitted through unseen pathogens was completely foreign to medieval medicine, which was rooted in ancient, often flawed, medical theories. In fact, many practices and beliefs, including the treatment of surgical wounds and the handling of surgical instruments, exacerbated the risks of infections, which in turn contributed to a staggering number of deaths. One of the most dangerous aspects of medieval surgery was the widespread belief that wounds needed to be exposed to air in order to heal properly. This theory, which originated from the humoral system of medicine that dominated the medieval understanding of health, was rooted in the belief that the body could heal itself if given the right conditions. According to the medical theories of the time, wounds needed to breathe in order to expel harmful bad humors or miasma, the concept of poisonous air or bad vapors. Consequently, many medieval surgeons deliberately left surgical wounds uncovered and exposed to the open air after performing procedures such as amputations, trepanations, or bloodletting. This approach, although well intentioned, was based on a complete misunderstanding of the body's healing processes, and it created an ideal environment for bacteria to enter the wound and cause severe infections. The practice of leaving wounds uncovered, especially in a time when the concept of sterilization did not exist, was incredibly hazardous. Medieval surgeons had no knowledge of bacteria or the role that microorganisms played in the spread of infection. They did not understand that open wounds exposed to the air could become contaminated with dirt, dust, and most importantly, harmful bacteria. These infections, which were often invisible to the naked eye, could spread quickly and lead to life-threatening conditions like sepsis, gangrene, or even death. As a result, patients who survived the initial surgical procedure often succumbed to infections shortly afterward, highlighting the dangerous nature of medieval surgery. One of the most common and deadly infections to emerge after surgery in the medieval period was sepsis. Sepsis is a life-threatening condition that occurs when the body's response to an infection goes awry, leading to widespread inflammation, organ failure, and in many cases death. In the medieval period, there was no understanding of sepsis or how it could develop as a result of an untreated or poorly managed infection. When bacteria entered the body through a surgical wound, they could rapidly multiply and release toxins that triggered an immune response. In the absence of antibiotics or modern medical treatments, the body's immune system often struggled to contain the infection, leading to sepsis. The symptoms of sepsis, which include fever, rapid heartbeat, confusion, and low blood pressure, were poorly understood at the time, and without effective interventions, patients would often die within a few days or weeks of the infection setting in. In addition to sepsis, gangrene was another common and deadly infection that resulted from medieval surgery. Gangrene occurs when tissue dies due to a lack of blood supply or infection. It typically begins as a localized infection at the site of a wound and then spreads to the surrounding tissue. In the medieval period, patients who underwent surgery, such as amputations, were particularly vulnerable to gangrene, as the surgical sites were often left exposed and untreated. The absence of sterilization meant that bacteria from the environment or from the surgeon's unclean hands and tools could enter the body and begin to break down tissue. The lack of effective treatment for gangrene meant that patients who developed the infection were at high risk of death. In severe cases, the infection could spread throughout the body, leading to septic shock and organ failure. The presence of bacteria in surgical wounds was exacerbated by the unsanitary conditions of the medieval operating rooms, which lacked any form of sterilization or hygiene protocols. Surgeons of the time operated in spaces that were often filthy and poorly ventilated, with no understanding of how to minimize the risk of infection. The tools used for surgery, including knives, saws, lancets, and scalpels, were not cleaned between patients. In fact, it was common for these instruments to be used repeatedly without any form of cleaning or disinfection. The same knives and saws that were used to cut through flesh and bone were often used on multiple patients, carrying bacteria from one wound to the next. This made infections not only more likely, but also more dangerous, as there was no attempt to prevent the spread of harmful microorganisms between patients. The lack of understanding of infection control was compounded by the absence of any concept of germs or microorganisms. The theory of germs, which would eventually lead to the development of germ theory in the 19th century, had not been established in the medieval period. Surgeons had no knowledge of how bacteria could be transmitted from person to person or from surfaces to wounds. The idea that microscopic organisms could cause infection was completely foreign to medical practitioners, and therefore no steps were taken to control the spread of bacteria. The absence of basic hygiene practices, such as washing hands before performing surgery, contributed to the widespread transmission of infections and the high mortality rate associated with medieval surgery. The medical community's lack of understanding about infection and its causes was not just limited to surgical practices. The prevailing belief in humoral theory, which posited that health was governed by a balance of four bodily fluids, blood, phlegm, black bile, and yellow bile, meant that treatments and interventions were often based on outdated and inaccurate ideas. Surgeons were taught to treat disease by manipulating the humors, which led to practices such as bloodletting, purging, and other procedures that weakened patients rather than helping them recover. Bloodletting, for example, was believed to restore balance to the body's humors, but it often left patients weakened and vulnerable to infection, making them more susceptible to the very diseases that bloodletting was supposed to cure. In the medieval period, there was also a lack of effective post-operative care. After a patient underwent surgery, there was little emphasis on wound care or preventing infection. Surgeons did not have access to antiseptics, so they could not clean or disinfect the wounds effectively. Wounds were often left uncovered or dressed with unsterile materials, further increasing the risk of infection. Bandages were sometimes used to cover the wound, but these were often not changed regularly, and they were not sterile. The lack of proper wound care, combined with the exposure of the wound to unsanitary environments, meant that infections were inevitable for many patients. Additionally, the lack of anesthesia and the painful nature of medieval surgery meant that patients were often in a weakened state even before the procedure began. The shock from the pain of the surgery, combined with the physical trauma, made patients more susceptible to infections. The body's immune system, already compromised by the trauma, was less able to fight off infections. For many patients, this made the difference between life and death. Even if a patient survived the immediate surgery, they were at high risk of dying from the infections that followed. The lack of effective medical treatments and understanding of infection led to a high mortality rate following surgery. Many patients who survived the initial procedure would die within days or weeks from sepsis, gangrene, or other complications resulting from infections. Surgical wounds, instead of healing, would fester and become infected, and patients who were once hopeful for recovery would quickly deteriorate. Even the most minor surgeries carried a significant risk of death due to the failure to manage infections. While some patients may have survived the immediate effects of surgery, the aftermath was often much deadlier. In some cases, surgeons would attempt to treat infections with herbal remedies or poultices, but these were rarely effective in combating the infections that plagued medieval patients. The absence of antibiotics, antiseptics, and proper medical knowledge meant that infections were almost always fatal. As medieval medicine progressed into the Renaissance and beyond, there was a gradual shift toward understanding the importance of sanitation, sterilization, and infection control. The discovery of germ theory in the late 19th century would revolutionize surgery and medical practices by showing that infections could be prevented by maintaining cleanliness and sterilizing instruments. The development of antibiotics in the early 20th century provided a powerful tool in the fight against infections, saving millions of lives and transforming the practice of surgery. In conclusion, infections were a leading cause of death during the medieval period, and the lack of understanding about bacteria and germs played a significant role in the high mortality rates associated with surgery. Medieval surgeons did not know the importance of sterilizing their instruments or the role that bacteria played in the development of infections. Wounds were often left uncovered, and the use of unsterile instruments and the exposure of surgical sites to unsanitary conditions led to deadly infections like sepsis and gangrene. Patients who survived the initial trauma of surgery often succumbed to these infections, which were often fatal. The legacy of medieval surgery serves as a stark reminder of the importance of hygiene, infection control, and scientific understanding in the practice of medicine. Despite the overwhelming evidence that medieval medical practices, like bloodletting and barbaric surgeries, were ineffective, harmful, and based on outdated theories, these practices persisted for centuries. Bloodletting, in particular, remained a widely accepted and common treatment well into the 19th century, despite accumulating evidence of its lack of success and its detrimental effects on patients. The reason for this persistence can be traced to a variety of factors, including the deeply ingrained medical traditions of the time, the reluctance of the medical community to abandon these practices, and the slow progress of scientific understanding in the field of medicine. Bloodletting, which had been practiced for centuries based on ancient theories such as the humoral system, was seen as a universal treatment for a wide range of ailments. The ancient Greek physician Hippocrates, often regarded as the father of medicine, believed that health depended on the balance of four bodily humors: blood, phlegm, yellow bile, and black bile. When the humors were thought to become unbalanced, illness would occur. Bloodletting was believed to restore balance by removing excess blood from the body, which was thought to cure various diseases. As a result, it became a central part of medical practice in both the Western and Islamic worlds. For centuries, bloodletting was used to treat a variety of conditions, from fevers and headaches to more severe illnesses like mental disorders and digestive problems. In the medieval period, it was considered a go-to remedy for many ailments, regardless of the underlying cause. The procedure, though harmful in many cases, was deeply rooted in medical traditions and was viewed as an essential part of the healing process. It was performed by a range of medical practitioners, from highly trained physicians to barber-surgeons, and even common folk believed in its curative powers. However, by the early modern period, it became increasingly evident that bloodletting was not effective, and in many cases, it was outright dangerous. The procedure often led to further harm, weakening patients and making them more susceptible to infections, especially as medieval surgical practices lacked the understanding of hygiene and sterilization. Bloodletting, when performed too frequently or in excessive amounts, could cause anemia, shock, and even death. Despite this, bloodletting continued to be practiced, often as a first-line treatment for various diseases, because it was so deeply ingrained in the medical community and society. One of the primary reasons bloodletting and other ineffective treatments persisted for so long was the deeply ingrained medical traditions and beliefs that shaped the practices of the time. For centuries, medical knowledge was passed down through a combination of texts from ancient scholars like Hippocrates and Galen, and it was accepted as established doctrine. These ancient texts were revered as the foundation of medical knowledge, and their teachings shaped the medical practices of subsequent generations. Galen, for instance, had an enormous influence on Western medicine, and his humoral theory of disease remained dominant well into the 17th century. His theories, though based on observation and logic, were flawed and failed to account for the true causes of disease. Yet, because they were rooted in centuries of tradition, they became the basis for medical education and practice across Europe and the Islamic world. In medieval and Renaissance Europe, physicians and medical practitioners often relied on these ancient texts without questioning their validity. The concept of humoral imbalance was accepted as a universal explanation for illness, and practices like bloodletting were viewed as effective treatments. Even as new ideas began to emerge, there was resistance within the medical community to abandon long held beliefs. This resistance was particularly strong because the humoral theory had been embedded in the training of physicians and surgeons for generations, and many were reluctant to discard a system of thought that had shaped their profession. Moreover, many medieval and Renaissance physicians were trained through apprenticeships and were steeped in the traditions of their teachers, who had learned from previous generations. This tradition oriented model of medical education reinforced the perpetuation of outdated practices. The reluctance to adopt new ideas was further compounded by the lack of communication between medical practitioners, as much of medical knowledge was disseminated in localized centers of learning with little interaction between different regions. This limited exchange of ideas made it difficult for revolutionary concepts to gain traction. The persistence of bloodletting and other outdated practices was also tied to the limitations of medical knowledge during the period. In the absence of a scientific understanding of anatomy, physiology, and microbiology, medieval physicians relied heavily on theories that had no empirical basis. The absence of effective diagnostic tools meant that medical practitioners had little insight into the true causes of disease. Bloodletting, as an all encompassing treatment for a wide range of ailments, was seen as a way to address the symptoms of disease without needing to understand its root causes. In many cases, physicians simply resorted to bloodletting as a one-size-fits-all approach, even if it did not have a measurable therapeutic effect. Despite the obvious failure of bloodletting, there were other factors that contributed to its persistence. For one, it was deeply ingrained in the medical culture of the time, and physicians were often hesitant to challenge the long-standing traditions of their profession. Additionally, bloodletting was relatively simple to perform and required minimal medical equipment, making it a practical treatment option for physicians, especially in an era when medical technology was rudimentary at best. It was also seen as a cheap treatment option, making it accessible to a wide range of patients. Furthermore, bloodletting was widely promoted and supported by the political and religious authorities of the time. In medieval Europe, many prominent physicians and medical scholars advocated for bloodletting, and its use was often sanctioned by the Church. The Church, which had a powerful influence on medical practices, approved of bloodletting as a morally acceptable treatment, and many religious leaders believed that it could help purge the body of impurities, which was in line with the Church's teachings about spiritual and bodily purification. This religious endorsement gave bloodletting a degree of legitimacy and reinforced its use in both medical and social contexts. Even as knowledge about the human body and disease progressed, bloodletting continued to be performed, in part because there were few viable alternatives. As medicine advanced during the Renaissance and Enlightenment periods, new discoveries began to challenge the traditional views on disease, and emerging concepts of human anatomy and physiology began to shift the understanding of health. The development of more sophisticated diagnostic tools, such as the microscope, allowed scientists to examine cells and microorganisms, leading to new insights into the causes of disease. However, many physicians continued to cling to the old practices, including bloodletting, due to the deeply rooted beliefs in humoral medicine and the lack of immediate, widely accepted alternatives. The acceptance of bloodletting also persisted because of the general lack of public awareness about medical science. Patients, especially those from the lower classes, often had little knowledge of how their treatments worked and relied on the recommendations of physicians or the local medical community. In many cases, the practice of bloodletting was performed as a ritualistic or preventative measure, even when patients were not actively suffering from a serious illness. Bloodletting was sometimes seen as a form of health maintenance, with the idea that periodic purging of blood would prevent illness. This mindset, combined with the lack of alternative treatments, contributed to the continued popularity of the practice. Even as medical advancements in the 18th and 19th centuries led to a more scientific understanding of disease, bloodletting remained a widely practiced treatment. It wasn't until the 19th century, with the development of germ theory and the understanding of infection and disease transmission, that the practice was widely condemned. The advent of antiseptic techniques, pioneered by individuals like Joseph Lister, provided physicians with the tools to prevent infections and treat wounds more effectively. As the medical community embraced these new discoveries, bloodletting fell out of favor, and more evidence-based treatments began to replace outdated practices. The reluctance to accept new medical ideas, especially within the medical profession, is a phenomenon that has been observed throughout history. Physicians and other medical practitioners are often deeply conservative in their approach to change, as medical practice is based on years of training, tradition, and accepted knowledge. The fear of being proven wrong or the anxiety about stepping away from established practices can hinder the acceptance of new ideas, even when there is overwhelming evidence that those practices are flawed. This phenomenon has persisted through various stages of medical history, and it was no different with the practice of bloodletting. Despite mounting evidence that the procedure was ineffective and harmful, it was difficult for many to let go of a practice that had been so deeply ingrained in medical tradition for centuries. In conclusion, the persistence of bloodletting and other harmful medieval medical practices can be attributed to a combination of factors, including deeply ingrained traditions, the lack of effective alternatives, and the medical community's reluctance to embrace new ideas. Despite the growing body of evidence that bloodletting was ineffective and harmful, the practice remained a cornerstone of medieval and early modern medicine. It wasn't until the 19th century, when advances in medical science, such as the development of germ theory and antiseptic techniques, radically changed the understanding of disease and treatment, that bloodletting was officially abandoned. The persistence of such practices in the face of overwhelming evidence to the contrary, highlights the difficulty of overcoming tradition in the face of progress and serves as a reminder of the importance of continued scientific inquiry in the field of medicine. The advancement of surgery and medicine in the medieval period was significantly hampered by the lack of scientific knowledge. Surgeons, despite their best efforts, were forced to work with limited understanding of the human body, often relying on outdated medical theories that had been passed down for centuries. Their practices, though well intentioned, frequently caused more harm than good due to their lack of knowledge, inappropriate methods, and inadequate tools. The absence of advanced technology, scientific research, and effective training meant that medical procedures were often based on guesswork, superstition, and ancient texts rather than empirical evidence. In addition to these intellectual shortcomings, medieval surgery and medicine were also hindered by unsanitary conditions and the lack of hygiene protocols, which led to widespread infections and a high mortality rate. Medieval surgeons operated without the benefit of an understanding of basic anatomy, and their knowledge of human biology was limited at best. The Greek physician Galen, whose ideas were dominant for over a millennium, shaped much of medieval medicine. His works, based on dissection of animals, were taken as gospel for understanding the human body, even though they were not based on accurate observations of human anatomy. Galen's theories were flawed, and many of his anatomical descriptions were incorrect. For example, Galen believed that the heart was the center of the body's circulatory system and that blood was consumed by organs rather than circulating throughout the body. These misapprehensions were passed on to medieval physicians and surgeons, limiting their ability to diagnose and treat illnesses properly. The lack of human dissection during the medieval period further compounded the limited understanding of anatomy. In most parts of medieval Europe, dissection of human bodies was prohibited, particularly by the Church, which viewed it as sacrilegious. Consequently, the study of human anatomy was either avoided or prohibited, and when it did occur, it was limited to cadavers of criminals or prisoners, and even then, only under certain conditions. Without dissection, medieval surgeons could not fully understand the internal structure of the human body, its organs, and its systems. Instead, they relied heavily on ancient texts and religious doctrine to inform their medical practices. As a result, many of their procedures were based on erroneous ideas and lacked a fundamental understanding of how the body functioned. In the absence of microscopes and advanced diagnostic tools, physicians were forced to rely on rudimentary methods of diagnosis and treatment. They had no way to examine the body's internal structures beyond what they could see with their naked eye, which limited their ability to make accurate diagnoses. The lack of diagnostic tools also meant that physicians were often unable to identify the underlying causes of diseases, resulting in treatments that were at best ineffective and at worst dangerous. Without an understanding of the nature of diseases, their transmission, or their causes, medieval medicine was a profession of trial and error. The result was a medical landscape where procedures and treatments, such as bloodletting, trepanation, and the use of herbal remedies, were common but often ineffective and harmful. Bloodletting, for example, was a widely practiced treatment for various ailments, from fevers and headaches to more severe conditions like mental illness. Bloodletting was rooted in the belief that the body contained four humors: blood, phlegm, black bile, and yellow bile, and that illness occurred when one of these humors became unbalanced. Physicians would use lancets or leeches to draw blood from the patient in an attempt to restore balance. However, there was no scientific basis for the humoral theory, and bloodletting often weakened patients further, making them more susceptible to infections and complications. Yet, despite its dangers, bloodletting remained a popular and standard treatment for centuries because it was based on ancient medical teachings that were accepted by both physicians and the general public. Another common practice was trepanation, a surgical procedure in which a hole was drilled into a patient's skull to treat head injuries, relieve pressure from traumatic brain injury, or cure ailments such as epilepsy. Trepanation was practiced as a treatment for various mental health conditions and was also used to remove evil spirits believed to be causing disease. However, the procedure was dangerous and barbaric, often performed without anesthesia or any understanding of the brain's functions. The tools used to perform trepanation were rudimentary and unsanitary, and the procedure often resulted in infections, brain damage, or death. Despite the lack of scientific evidence supporting its efficacy, trepanation was widely practiced for centuries based on outdated theories about the cause of disease. In addition to their lack of understanding of anatomy and disease, medieval surgeons and physicians were often ill equipped to perform procedures safely. Surgical instruments were crude and unsterilized, and there were no standards for cleanliness or hygiene in the operating room. Surgeons typically used knives, saws, and lancets that were often reused without any cleaning or disinfecting. This practice led to a high risk of infection, as pathogens from one patient could easily be transmitted to the next. Wounds from surgeries were often left uncovered, further exposing them to dirt, bacteria, and other contaminants. The lack of sterilization and basic hygiene protocols meant that infections, including sepsis and gangrene, were common and often fatal. Even minor surgeries, such as bloodletting or tooth extractions, could result in deadly infections. In fact, the absence of proper tools and hygiene training left countless patients vulnerable to the effects of infections. Surgeons of the time had no understanding of germs or bacteria and did not know how to properly clean their instruments or sanitize their work environment. The lack of sterilization meant that surgical procedures often led to infections that were difficult or impossible to treat. In some cases, physicians would try to treat infections with herbal remedies, but these were largely ineffective. Without antibiotics or antiseptics, there was little hope for patients who developed infections after surgery. Many patients died from sepsis, gangrene, or other infections that would have been preventable with modern sanitation practices. The medieval period's reliance on outdated medical theories and a lack of scientific knowledge was not limited to surgery. Throughout this era, medicine was closely tied to religion and superstition. The church played a dominant role in medical practice, and religious beliefs often influenced medical decisions. Many diseases were believed to be caused by divine punishment, demonic possession, or a punishment for sin. This religious framework affected how physicians treated their patients and limited their ability to view disease through a scientific lens. As a result, treatments were often based on faith rather than evidence, and the focus of medical practice was as much on spiritual healing as it was on physical health. Medieval physicians were also influenced by the ancient Greek and Roman medical traditions, particularly the works of Galen. Although Galen's theories were foundational in shaping medical thought for centuries, many of his ideas were incorrect and based on a limited understanding of human biology. Galen believed that the body was governed by four humors, similar to the medieval belief in humoral theory, and that imbalances between these humors were the cause of disease. His descriptions of anatomy were based on animal dissections, not human dissections, which led to significant errors in understanding human physiology. Nonetheless, his theories were widely accepted, and his works became the cornerstone of medical education for centuries. In addition to the intellectual limitations of medieval medicine, there were also practical challenges that hindered the advancement of medical knowledge. The lack of proper medical institutions and universities meant that medical knowledge was not systematically advanced or shared. While some medical schools existed in places like Salerno and Bologna, the education was often focused on theoretical texts and outdated practices rather than hands on clinical experience. Furthermore, the Church's censorship of certain scientific and medical ideas stifled the development of new knowledge. Many important advancements in science and medicine were delayed or suppressed for fear of challenging religious dogma or established authority. The rise of universities in the late medieval and early Renaissance periods eventually led to a shift in medical education. Universities such as Padua and Paris began to train physicians who were exposed to a more systematic and scientific approach to medicine, including some attempts at dissections and experimentation. However, the lack of scientific tools and a consistent understanding of anatomy and disease meant that even these advancements were limited in scope. Moreover, the broader medical community, including surgeons, continued to rely on ancient texts and outdated theories for much of the medieval period. Despite these challenges, some medical practitioners began to question the prevailing medical traditions in the late medieval period. Figures like Paracelsus, a Swiss physician and alchemist, rejected many of the ancient ideas that had dominated medical thought for centuries. Paracelsus advocated for a more experimental and chemical approach to medicine, emphasizing the importance of observation and direct study of the human body. However, his ideas were controversial and met with resistance from the established medical community. It would take centuries of scientific advancements and the work of pioneers like William Harvey, who discovered the circulation of blood, and Louis Pasteur and Robert Koch, who developed the germ theory of disease, before medicine and surgery truly began to evolve. In conclusion, the advancement of surgery and medicine during the medieval period was hindered by the lack of scientific knowledge, insufficient tools, and inadequate training. Surgeons and physicians of the time operated without understanding basic anatomy or the mechanisms behind diseases, and their reliance on outdated theories resulted in treatments that were often ineffective and harmful. The absence of hygiene, sterilization, and proper surgical techniques contributed to the high mortality rate from infections and complications. However, despite these challenges, the medieval period laid the groundwork for future advancements in medical science. It was only through the gradual accumulation of scientific knowledge, the rise of universities, and the work of pioneering physicians that medicine began to progress beyond the limitations of medieval practices. The dark history of medieval surgery and medicine serves as a reminder of how far we have come in understanding the human body and the importance of evidence-based medicine in improving patient care. Today, when we look back on the medieval surgeon's toolkit, it is with a mixture of horror and disbelief. The crude instruments, the unsanitary conditions, and the dangerous procedures that were common during this era seem almost incomprehensible when compared to the sophisticated, life-saving surgeries, and treatments that are available to us in modern medicine. The idea that surgery could be performed with little understanding of human anatomy, using unsterilized tools, and without anesthesia is almost unimaginable to those living in an era of scientific enlightenment and medical advancement. Yet, as much as we may recoil at the barbaric nature of medieval surgical practices, it is important to remember that these practices were based on the best understanding of medicine at the time, limited by a lack of scientific knowledge and the absence of modern tools. Despite their harmfulness and inefficacy, the procedures and treatments used during the medieval period laid the groundwork for the development of modern medical science. In this context, we must recognize how far medicine has come and reflect on the profound impact that the advancement of scientific knowledge has had on the field of medicine. One of the most emblematic practices of medieval surgery was bloodletting. Bloodletting was considered a universal treatment for almost every known ailment, from fevers to headaches, and even for mental health conditions. It was based on the ancient theory of humorism, which posited that health depended on a balance between four bodily humors: blood, phlegm, black bile, and yellow bile. When these humors were thought to become unbalanced, illness would follow. Bloodletting was believed to restore this balance by removing excess blood from the body. This practice was endorsed by prominent figures in medical history, including the ancient Greek physician Galen, whose theories dominated Western medical thought for centuries. In the medieval period, bloodletting was not just a theoretical treatment, it was a common, widely accepted practice performed by physicians, surgeons, and even barbers, who often acted as the primary medical practitioners of the time. The procedure itself was performed by making incisions in the skin, usually in the arm or neck, and draining a specific amount of blood from the patient. Lancets, leeches, and cupping glasses were commonly used tools in the practice of bloodletting. Despite its widespread use, bloodletting was not only ineffective, but also harmful. It often left patients weakened from the loss of blood, and in many cases it caused additional harm by increasing the risk of infection. The tools used for bloodletting were rarely, if ever, sterilized, and patients often suffered from secondary infections, many of which were fatal. Additionally, bloodletting was performed without any knowledge of the body's circulatory system, making it a reckless and dangerous procedure. It wasn't until the 19th century, after the advent of scientific medicine and the discovery of the circulatory system by William Harvey, that bloodletting was officially abandoned as a medical practice. The evolution of medical science and the abandonment of practices like bloodletting reflect how far medicine has come since the medieval period. Modern medicine, with its advanced surgical techniques, sterilization methods, and understanding of human biology, has allowed us to make incredible progress in treating and preventing disease. Today, surgeries are performed with precision and care, and advancements in imaging technology, such as MRIs and CT scans, allow surgeons to view the inside of the body with unparalleled accuracy. The tools used in modern surgeries are far more advanced than those of the medieval period, with instruments made from sterile, high-quality materials designed for specific functions. Surgeons today can operate with far greater precision, and the ability to monitor a patient's vital signs in real time means that complications can be detected and treated promptly. One of the most important advances in modern surgery is the understanding and application of sterilization techniques. In medieval times, the idea of sterilizing surgical instruments, or maintaining hygiene during medical procedures was non existent. As a result, infections were rampant, and surgical procedures often led to the patient's death due to sepsis or gangrene. Surgeons of the time had no knowledge of bacteria or how infections were transmitted, which meant that they did not take precautions to prevent them. In contrast, the discovery of germ theory in the late 19th century by scientists like Louis Pasteur and Robert Koch have revolutionized medicine. Pasteur's work on the germ theory of disease demonstrated that microorganisms were responsible for causing infections, and this understanding led to the development of sterilization techniques. The use of antiseptics, pioneered by Joseph Lister, became standard practice in surgery. Lister introduced the use of carbolic acid to disinfect surgical instruments and sterilize wounds, drastically reducing the risk of infection. Today, sterilization is an essential part of any surgical procedure, and the concept of hygiene is ingrained in every aspect of medical practice, from hand washing to the sterilization of instruments and operating rooms. Another significant development in modern medicine is the advancement of anesthesia. In medieval surgery, patients were subjected to excruciating pain during surgical procedures as there was no effective way to numb the body or dull the pain. Surgeons relied on rudimentary pain management techniques such as alcohol, opium, and hypnosis, but these were inadequate and often ineffective. The lack of anesthesia meant that surgeries were performed while the patient was fully conscious and aware of the pain. The introduction of anesthesia in the 19th century, with the discovery of ether and chloroform as anesthetic agents, revolutionized surgery. Anesthesia allowed surgeons to perform complex and invasive procedures without causing unnecessary suffering to the patient. Today, the use of anesthesia has become routine in surgery, with a variety of anesthetic options available to ensure that patients are comfortable and pain free during their procedures. The understanding of human biology has also advanced dramatically since the medieval period. Surgeons today have a far deeper understanding of anatomy, physiology, and the body's internal systems. The development of modern medical imaging technologies, such as X rays, ultrasounds, and MRIs, allows physicians and surgeons to visualize the internal structures of the body in great detail, helping to diagnose diseases and plan treatments with greater precision. In contrast, medieval surgeons had no access to such technologies and often relied on incorrect assumptions about the body's anatomy. For example, they followed the teachings of Galen, whose anatomical knowledge was based on animal dissections rather than human ones. This led to many misconceptions about human anatomy that persisted for centuries, hindering the progress of medical science. In addition to advancements in surgical techniques, sterilization, and anesthesia, modern medicine has also made remarkable progress in disease prevention. In the medieval period, diseases such as the plague, smallpox, and tuberculosis were widespread and deadly, and physicians had little understanding of how these diseases spread. Quarantines and rudimentary treatments were employed, but without a true understanding of disease transmission, they were largely ineffective. It was not until the development of germ theory and the advent of vaccines that significant strides were made in preventing infectious diseases. The development of vaccines for diseases such as smallpox, polio, and diphtheria has saved millions of lives and prevented countless outbreaks. Today, vaccines are an essential tool in public health, and the development of new vaccines continues to be a major area of medical research. Modern medicine's ability to treat chronic conditions and manage long-term health issues also marks a significant departure from the medieval era. In the past, diseases such as diabetes, hypertension, and heart disease were often fatal or poorly managed due to a lack of understanding of their causes and treatment options. Today, advances in medical research, pharmaceuticals, and technology have allowed for the development of medications and treatments that can manage these conditions effectively. For instance, insulin therapy has transformed the lives of individuals with diabetes, and modern treatments for heart disease, such as statins and blood thinners, have significantly reduced the mortality rate associated with cardiovascular conditions. Furthermore, the field of surgical specialization has allowed for more focused and effective treatments. In the medieval period, surgery was often performed by barbers or general practitioners who lacked specialized training. Today, surgery is divided into numerous specialized fields such as neurosurgery, orthopedic surgery, and cardiothoracic surgery, each with its own set of techniques, tools, and expertise. This specialization allows for more precise and effective treatments for a wide range of conditions, and surgeons can now perform complex procedures with a much higher degree of success than in the past. Despite the significant progress made in modern medicine, the barbaric surgeries of the medieval era serve as a grim reminder of the importance of scientific progress and the need to constantly challenge outdated beliefs in the pursuit of better health. Medieval surgery and medicine were characterized by a reliance on superstition, tradition, and outdated theories, and these practices caused untold suffering and death. Today, modern medicine is based on evidence, research, and scientific principles, and it continues to evolve as our understanding of the human body and diseases advances. The medical field has come a long way, but the lessons learned from the mistakes of the past serve as a powerful reminder that medical practices must be continuously evaluated, challenged, and improved to ensure that they are truly beneficial to patients. As we reflect on the progress of modern medicine, we must also acknowledge the invaluable contributions of pioneers in the field who pushed the boundaries of knowledge and practice, often at great personal risk. The development of anesthesia, sterilization, antibiotics, and vaccines all represent monumental achievements that have transformed surgery and healthcare. These advancements were made possible by the application of scientific principles, empirical research, and a commitment to improving the quality of life for patients. By understanding the mistakes of the past, modern medicine is better equipped to avoid repeating them and to continue its mission of healing, innovation, and progress. In conclusion, the barbaric surgeries of the medieval period serve as a stark contrast to the advanced evidence-based practices of modern medicine. The lack of scientific knowledge, the reliance on outdated theories, and the absence of proper tools and hygiene resulted in a medical system that, despite its best intentions, often caused more harm than good. However, as we look back on these practices with horror, we must also recognize how far medicine has come. The development of advanced surgical techniques, sterilization methods, anesthesia, and a deeper understanding of human biology has allowed modern medicine to make incredible strides in treating and preventing disease. Today, we are able to heal and save lives in ways that medieval practitioners could never have imagined. The progress made in medicine, though remarkable, reminds us of the need to continually challenge outdated beliefs and practices, ensuring that medical science continues to evolve for the benefit of all. While medieval medicine may seem primitive and inhumane by today's standards, it is essential to recognize that it laid the foundation for many of the medical advances we now take for granted. The journey from the crude and often fatal practices of the medieval period to the sophisticated and life saving treatments available today is a testament to the power of scientific progress and human perseverance. In looking back at the history of bloodletting, barbaric surgeries, and other medieval medical practices, we are reminded not only of the darker aspects of human history, but also of how far we've come in understanding the human body and how vital hygiene, proper tools, and scientific research are to the practice of modern medicine. The medieval period was marked by a lack of scientific understanding, which directly influenced the medical practices of the time. For much of the era, medical theories were based on ancient traditions, with a heavy reliance on the ideas of early physicians like Hippocrates and Galen, whose teachings were considered unassailable truths for centuries. Their understanding of anatomy, physiology, and disease transmission was limited, and much of their work was based on observation and philosophical reasoning rather than empirical evidence. This reliance on ancient texts led to the widespread practice of bloodletting, trepanation, the drilling of holes into the skull, and other brutal and often ineffective medical procedures. However, the enduring influence of these ancient medical concepts was not entirely without merit. While many of these practices were deeply flawed, they laid the groundwork for the eventual development of more effective and humane treatments. Bloodletting, for instance, was widely practiced in medieval Europe as a treatment for a variety of ailments, including fevers, headaches, and even mental illness. The procedure was grounded in the ancient Greek theory of humoralism, which suggested that the balance of four bodily humors, blood, phlegm, black bile, and yellow bile, determined health. Bloodletting was believed to restore balance by removing excess blood from the body, but there was no understanding of the circulatory system or the true effects of blood loss. Despite its harmful consequences, such as anemia, infection, and death, bloodletting remained a central part of medical practice for centuries. Its prevalence serves as a reminder of the deep connection between tradition, cultural beliefs, and medical practice, even when the science was incorrect. The widespread acceptance of bloodletting, as well as other harmful practices, was in part due to the absence of scientific research and the lack of critical questioning of established knowledge. The medieval medical system was heavily influenced by religious and philosophical doctrines, and many of the prevailing ideas about health and disease were rooted in spiritual or supernatural explanations. For example, diseases were often believed to be the result of divine punishment or evil spirits, and healing practices were often tied to religious rituals or faith based remedies. This intersection of religion and medicine hindered the development of more effective, scientifically grounded treatments and contributed to the persistence of ineffective methods such as bloodletting. The history of medieval surgery is similarly marked by practices that by modern standards seem cruel and inhumane. Surgical procedures were performed without anesthesia or antiseptics, making them not only incredibly painful, but also highly dangerous. Surgeons lacked a proper understanding of anatomy and physiology, relying instead on ancient anatomical theories and trial and error methods. Procedures such as amputations, trepanations, and the removal of tumors were performed with rudimentary tools, often in unsanitary conditions. Many patients died from infections, blood loss, or complications following surgery, as surgeons had no knowledge of germs or bacteria and could not sterilize their instruments. Yet, despite these gruesome realities, medieval surgery laid the groundwork for modern surgical practices. Even in the absence of advanced medical knowledge, medieval surgeons developed techniques for performing basic surgeries that would eventually be refined and perfected in later centuries. In some cases, they even performed complex procedures, such as setting broken bones, removing foreign objects, and treating battlefield injuries that would become standard in modern surgical practice. The skill and resourcefulness of medieval surgeons, working with the limited tools and knowledge at their disposal, should not be underestimated. Their experiences, as painful and traumatic as they were, contributed to the gradual accumulation of medical knowledge that would later fuel the medical revolution. In the centuries following the medieval period, the scientific revolution played a pivotal role in reshaping medicine. Advances in anatomy, physiology, and biology, fueled by new methods of experimentation and observation, laid the foundation for modern medical practice. One of the most significant milestones was the work of Andreas Vesalius, a 16th century physician whose groundbreaking anatomical studies challenged many of the prevailing ideas about the human body. Vesalius performed dissections on human cadavers, directly challenging the ancient and incorrect teachings of Galen, and produced the first accurate, detailed maps of human anatomy. His work revolutionized the understanding of the body and set the stage for future advancements in surgery. As understanding of the human body improved, so did surgical techniques. The development of anesthesia in the 19th century, for instance, marked a monumental shift in the practice of surgery. Prior to anesthesia, patients were subjected to excruciating pain during surgery, often without any form of pain relief. Surgeons had little choice but to perform procedures quickly, knowing that the patient's pain and trauma could cause shock or even death. The advent of anesthesia, first in the form of ether and later chloroform, allowed surgeons to perform procedures at a more measured pace, greatly improving both patient outcomes and the accuracy of surgical procedures. This was a direct response to the brutal and painful surgeries of the medieval period, providing patients with the comfort and care that was previously unimaginable. The introduction of antiseptics was another critical step in improving the safety and success of surgical procedures. In the medieval period, surgery was often performed in unhygienic conditions, with unsterilized instruments and poorly cleaned wounds. The lack of understanding of the role of bacteria in infection meant that surgeries were a major source of harm, often leading to fatal infections. The work of Joseph Lister, who promoted the use of carbolic acid to sterilize surgical instruments and wounds, was a turning point in medical history. Lister's discovery that sterilizing instruments and maintaining a clean environment could prevent infection revolutionized surgery and drastically reduced mortality rates. This concept of aseptic technique laid the foundation for modern medical practices, where the prevention of infection is paramount in all surgical settings. Alongside improvements in surgical techniques and infection control, the understanding of human biology and disease transmission made incredible strides in the centuries following the medieval period. The work of Louis Pasteur and Robert Koch in the 19th century, which led to the development of the germ theory of disease, provided a scientific explanation for the spread of infection and revolutionized the practice of medicine. Pasteur's work on pasteurization, which demonstrated that heating liquids could kill harmful microorganisms, and Koch's development of methods to identify specific pathogens responsible for diseases, transformed the way doctors and surgeons approached disease. This marked the beginning of a new era in which disease prevention and treatment could be guided by empirical evidence and scientific reasoning rather than superstition or outdated theories. As medicine continued to evolve, advances in pharmaceuticals also played a key role in improving patient care. In the medieval period, the understanding of disease treatment was limited, and many common diseases were untreatable. Patients often had to rely on herbal remedies or superstitious practices, which were ineffective or harmful. With the development of modern pharmaceuticals, however, doctors gained access to a wide range of medications that could treat infections, pain, and chronic conditions. The discovery of antibiotics, such as penicillin by Alexander Fleming, and the development of vaccines, such as the smallpox vaccine by Edward Jenner, saved countless lives and have been critical in the fight against infectious diseases. Despite the major advancements made in the understanding of human biology, the practice of surgery and disease prevention, the history of medieval medicine serves as a stark reminder of how far we've come and the importance of continued scientific research. The brutal practices of the medieval period, such as bloodletting and barbaric surgeries, were rooted in a fundamental misunderstanding of the human body and disease. These practices caused untold suffering and death, and they persisted for centuries because of deeply ingrained beliefs and a lack of scientific knowledge. Yet the legacy of these practices cannot be entirely dismissed. While they were misguided and often harmful, they laid the groundwork for future progress by providing a foundation on which later generations could build. The history of medieval medicine underscores the need for scientific inquiry and evidence-based practice in modern healthcare. The tragic consequences of the medieval period, where superstition and tradition dictated medical practices, serve as a reminder that progress in medicine is only possible when we question established norms and pursue knowledge through observation, experimentation, and rigorous testing. Modern medicine has made incredible strides in improving patient care, extending life expectancy, and curing diseases that were once considered fatal. However, as the history of medicine has shown, we must never stop questioning and improving our understanding of the human body, disease, and the methods we use to treat them. In conclusion, while medieval medicine may seem primitive and inhumane by today's standards, it is important to remember that it laid the foundation for the medical advancements we now take for granted. The history of bloodletting, barbaric surgeries, and other outdated practices serves as a reminder of how far we have come in understanding the human body, the importance of hygiene, proper tools, and scientific research. The perseverance and dedication of medical professionals throughout history have ensured that such practices no longer have a place in modern healthcare, and they continue to push the boundaries of knowledge to improve patient care. Today's advancements in surgery, disease prevention, and pharmaceuticals are a direct result of the hard-won lessons learned from the mistakes and limitations of the past. The progress we have made in medicine demonstrates the value of scientific progress and serves as a reminder of the importance of continued research and innovation in the pursuit of better health.